I'm going to perform this skill for suctioning. First, I would check the physician's order to see what suctioning needs to be performed. Then I would prepare my equipment, so I would get the suction catheter kit. Then I'm going to assess the patient's lung sounds, heart rate, and rhythm before the procedure would be performed. Suctioning is done when a patient cannot clear any secretions on their own. I would perform hand hygiene first and wear a face mask with eye shield on it. And then I'm going to identify the patient by two identifiers. Can you tell me your name and date of birth?
It's Brandy Meredith, and my birthday's 4/11/93.
Okay. Okay, and then this is the sterile technique. So I would open this. Okay, and with this kit would come a little container for the saline and also lubricant jelly. Um, this is considered sterile, so what I'm going to do is I'm going to attach it. Then I would turn the section on. I would dip it in the saline and then the lubricant, and you have to be in and out within 10 seconds. And I would go into the patient's. I would have the patient lean back, go in the nasopharyngeal, go down until the patient coughs, and then as I would intermittently suction while twirling the catheter all the way back out. Make sure to keep this sterile because you can go back in another time. You'd have wait 1 minute in between, and then after it, I would disconnect and pull that back up. Take that in the one. And dispose of this. I would check the patient's pulse and skin color after the procedure is performed. To dispose of all this, I would put all of the equipment that I use in the biohazard trash bag. And for documentation, I'm going to document the signs and symptoms of the patient before and after the procedure was done, what procedure was done, also any secretions that were removed. Restraint is ordered from him, and then you always want to use the least restrictive. So the least one would be the torso belt. Then is the limb restraints, and then the most restrictive is the chemical, which is the medication. There cannot be a standing order or a PRN order for restraints. I'm going to perform the limb restraints, so the wrist restraints. So I would wash my hands and put my gloves on. And you'd position the patient in the most comfortable position. Most of the time, the patient would probably be sitting up more. So I'm going to. Okay. And you're going to put the padded side down on the patient's wrist. And you want to allow 2-finger space between, that way it's not too tight on the patient. And make sure that all of the bands are straight and not okay. And then when you tie the restraint, you would use a slip knot technique. And you would tie it to the bed frame and not the side rail. That way, the patient can't get caught or any kind of harm done to the patient. You would always explain the purpose of the restraints to the client and their family, and let the family know when the restraints are put on. Um, the client must be observed every 15 minutes when they have restraints on, and the restraints should be taken off every 2 hours for at least 5 minutes. And when you take them off, you should check the skin integrity. You should do range of motion and position change to make sure that no skin breakdown happens. You would make sure that the pad is on any bony prominences, such as the wrists and the ankles, if that's where you put them. And for documentation, you would document the client's symptoms that led to the implementation of the restraints, which is subjective and objective, and then you would document when you put them on. And you would also document every time that you assess the patient, which is every 15 minutes. You would document the findings, and then also when the restraints are removed. And you would use a slip knot when tying the restraint to the bed frame, because then in case of an emergency, it's easy to undo, but the patient cannot get out of it. Okay, now I'm going to perform the skills for blood pressure and pain assessment. The first thing is the blood pressure. The normal for a healthy adult is 120/80. Blood pressures can vary depending on the position that the patient is in. The most common position that you would put a patient in to take a blood pressure is relaxed reclining or sitting upright. You're going to assess the client, and you're going to ask them whether they have smoked or exercised within the last 15 minutes. Have you smoked or exercised in the last 15 minutes?
Nope.
Okay, because that will alter the blood pressure. You instruct the clients to not cross their legs or no talking while you're taking their blood pressure, because the client's activities and slouch position can also yield a false high reading. Okay, now I'm going to take the patient's blood pressure. First, I'm going to, after I apply the cuff, I'm going to palpate. Okay, and I will inflate this 30 Hg over the pulsations that I felt. So once I stop feeling the pulsations, I'll inflate it 30 more and then release it. Okay, and now I'm going to take the patient's blood pressure. Okay, and her blood pressure was 124/82. Now the first sound that you hear is the systolic blood pressure, which is the 124, and the diastolic blood pressure is the 82. You would deflate the cuff and wait 1 to 2 minutes before checking the patient's blood pressure if you need to. Okay, and for documentation for the blood pressure, I would document what her blood pressure is, that I took it in her right upper extremity, and the time that I took it. Now for the pain assessment, I would ask the patient on a scale of 0 to 10, what is your pain?
None.
Okay, and if she did have pain, I would ask the type of pain, where it's located, the quality of the pain, the intensity, if it's dull or stabbing, if it radiates, or if it just stays in one place. And then for documentation for that, I would document all of the findings that I found and what her pain is.